A study on the use of virgin coconut oil to manage and prevent COVID-19 is showing promising results. Researchers say VCO, which is extracted from coconut meat, has antiviral properties. Now with us is Dr. Jose Mondejar, the medical director of Equilibrium Integrative Health Clinic. Dr. Mondejar, good afternoon.
Hi, good afternoon, sir.
Hi, Doc. Now, we reported about VCO and its properties that can fight the virus, and we've actually talked to Dr. Fabian Dairit before about these things. But now you're saying that there have been actual studies and the results have been promising. Tell us more about these studies, these tests, how they were conducted and how many people were tested.
Sure, thank you so much. It happened on the first, or rather second week of April, of which the personnel in charge in CPDRC, the Cebu Provincial Rehabilitation Detention Center, called us to seek for advice and help, of which parallel to what we did on the last week of March, in the first cases in Cebu in Sitio Zapatera, Barangay Luz, Cebu City, what we did manage on that area, out of 69 isolated positive cases, within 14 days, we were able to lower the number of cases, became negative. 45 cases became negative in 14 days. And the remaining 24 cases became negative for the following week after testing. So we were invited to come in to help manage CPDRC on top of the LGU management at that time with DOH. So successfully, 20 inmates with another 19 employees became negative within 7 to 10 days of our management using coconut oil.
Are there any more studies that are being conducted right now? You mentioned that this happened way back April.
Sure. As of now, we're just also waiting for. I would say this is not really a formalized study. It's rather than a clinical data what we've gathered here, and we share this with the team of Dr. Fabian Dairit of Ateneo de Manila.
Right.
So further on, we're just waiting for any institutions would like to avail with this kind of management here in Cebu City.
But do you think how much longer, how much more research and study should be done before we can actually say and officially say that VCO is an effective treatment and something that can prevent from a person from getting the disease?
Yes, this is a very interesting topic because when we look back, with due respect, with the father of coconut oil, I mentioned about Dr. Conrado Dairit. He is actually the pioneer who studied coconut oil. This is with regards with HIV, the H virus. So there is nothing new with this properties of the coconut oil as an antiviral, capacity or capabilities. So yes, the answer is yes. Hopefully, with the support with PCHRD and DOST, we'll be able to have really a formalized, modified clinical trials, randomized in the future, headed by the teams, of course, with the help of Dr. Fabian Dairit. This is our thrust with this.
But even before that happens, the formalized trials, can you recommend people use it now to prevent them from getting the disease?
Absolutely, sir. Based on the following data that we presented, up to date, there are no more cases of COVID cases in CPDRC for about 7 weeks as of today. So, in connection with this, the data would show that it is not only very important as an adjunctive management on top of the DOH program, but rather it will act like a preventive measures to help our countrymen.
What would be the recommended dosage? How much should a person take in a day? And for how long?
Yes, a very good question. I always get that question. So what I prescribe personally in our clinic, in our practice, is we started with very moderate, very low dose, meaning 15 ml. That's about a tablespoon twice a day for about 2 to 3 days. And then if there's no other, it's just a mild reaction. What we call it's a mild diarrhea. People who are sensitive with oils.
Mm-hmm.
But after 3 to 5 days, they get into this level of momentum and accustomed, the body is accustomed to this. So I raise up the dosage to 1 tablespoon 3 times a day, of which this dosage we used in CPDRC.
Okay, but we do want to ask as well, are there any side effects in consuming virgin coconut oil, most especially for those who may have heart illnesses?
Oh well, there are actually, when we based on the research out there, there's a lot of conflicting results out there. In fact, there was a study that showed with the Dutch study. They studied the 60 trials out there, basing on the effects of coconut oil is a saturated fat,
Mm-hmm.
but anything extra is harmful as well to the body. So we have to caution everyone that if you take coconut oil firsthand, the effect of this is a mild diarrhea. And other than that, clinically, it will initially partly raise up the LDL. They consider this bad cholesterol,
Right.
but otherwise it will elevate as well the HDL, which is the good cholesterol. So overall, coconut oil, for me, and based on the conflicting studies, is not really harmful for the heart.
Okay, Dr. Jose Mondejar, thank you very much for talking to us about the effects of virgin coconut oil. Maraming salamat
Thank you
po.
so much. Maraming salamat.